I'm Deanne. I'm the Invisalign Territory Manager in Oklahoma, and I am here today with Lauren in the Ada, my dentist office. And Lauren, I just want to reach out to you. You are, and your team here in Ada are one of the most successful Invisalign practices in the My Dentist family of offices. And there's a reason for that. And that is teamwork. So if you would, what I'd like to do is just have you share some experiences with your fellow hygienists that are attending the meeting on June 13th, and give us a little bit of insight on how you were able to work as a team so well down in your office in Ada. When you took the Invisalign course and your doctor took the Invisalign course and came back, what were your initial thoughts about incorporating Invisalign into the practice?
Honestly, I would find myself to have been a little bit skeptical, concerned, not have been around Invisalign too much. But after learning a little more about it and seeing some pictures of results, it started to tweak my interest. So, finding out more about the actual process definitely made a difference to me to allow my thoughts to expand a little more.
So you felt like the initial training wasn't, you needed more information to kind of pull all the pieces together.
Sure.
Where you could feel comfortable in talking to your patients about it.
Right.
At that first staff training, what was the one thing that really got your attention that, hey, we may be onto something here for patients' health?
When it comes to our office as a whole, I think that we've found being more preventive minded, fixing the problems that are actually creating the symptoms is kind of where I feel like all of our doctors and the hygienists that are here in the office and the staff as well has kind of directed our attention to. After that first training, it allowed us to see a broader picture and helped us learn to find more reasons as to why some of these bigger things were happening.
So you felt really, too, that it was in the best interest of your patient for you to learn more.
Definitely.
And how to talk to them.
Absolutely.
So things started happening, and did you feel like that any of these Invisalign conversations or discussions about malocclusion would interfere with your normal schedule? Because I know you guys are really busy here.
I personally don't, because anything to make my job easier in the long run as a hygienist, I think we all as hygienists know that will benefit us as well in the long run. By being able to straighten those areas that are causing these problems, not just because of the bacteria and the things that we know that cause bleeding and infection and such, but creating the malocclusion that we see has definitely is a big problem when it comes to the hygiene side of it. Mm-hmm. So no, incorporating that into my hour or being able to visualize that and kind of reading the patient on where they are as far as what they want permanently for themselves definitely has turned in my mind.
So, and because you're able to have those conversations, you're now, it sounds like you're looking for them, looking for opportunities to have those conversations. In terms of what that's done for your office, just in the first 3 months of this year, your office has started 16 cases of Invisalign. And that is really remarkable. And I know you can't do it without a doctor backing you up, and your doctor can't do it without you having the conversation. Right. And none of you could do it without your team, support of your entire team, your treatment coordinators, office managers, etc. I can't thank you enough for this time, and if you want to say hi to everybody in the study club, you can wave now.
Hi guys, sorry I'm not able to be here. I am in Kansas City this week, but you guys listen really hard and strong, because I promise you, finding the reasons that are creating the issues that cause us to have to work that extra amount of time or to try and really boggle our mind to find the reasons to help fix their bleeding problem. Look for malocclusion. It makes a big difference.